How uncomfortable is a flu test nasal swab? Have you ever wondered how uncomfortable a flu test nasal swab really is? Let's dive into what you can expect during this procedure. A flu test nasal swab typically causes mild to moderate discomfort. Most people find it manageable and well tolerated. The process involves inserting a sterile swab into one of your nostrils. The swab is advanced horizontally back toward the nasopharynx, which is the upper part of your throat located behind your nose. This insertion goes to a depth roughly equal to the distance from your nostrils to your ear opening. While this might sound a bit daunting, the sensation is often just uncomfortable. You may feel a tickling or slight burning sensation, and it can sometimes trigger sneezing or watery eyes. The swab is rotated several times and held in place for a few seconds to collect enough mucus and cells for accurate testing. During this brief moment, you might feel a sensation of pressure or irritation, but it is not considered painful. Some individuals, especially children or those with sensitive nasal passages, might find the experience a bit more uncomfortable or distressing. There are different types of swabs used for flu testing. The nasopharyngeal swab, which reaches deeper into the nasal cavity, tends to be more uncomfortable than the anterior nasal swab. The anterior nasal swab only collects samples from just inside the nostrils and is generally less invasive and more comfortable. However, nasopharyngeal swabs often provide more reliable samples for detecting influenza viruses, especially when using molecular tests like reverse transcription polymerase chain reaction. On the other hand, anterior nasal swabs may be slightly less sensitive depending on the test used. In summary, while a flu test nasal swab can cause some temporary discomfort due to the depth and technique required for sample collection, it is a quick and generally safe procedure that is essential for accurate influenza diagnosis. Healthcare providers aim to perform the swab gently and efficiently to minimize discomfort while ensuring a quality specimen. If you have concerns about the procedure, it is always best to consult with a healthcare professional for personalized advice.